Elixaban 5mg tablet. Elixaban 5mg tablet is a blood thinner that helps prevent and treat blood clots. It works in the veins of your legs, lungs, brain, and heart to prevent strokes and heart attacks. This medicine is often given to people with irregular heartbeats, atrial fibrillation, to stop clots from forming. It also helps prevent clots in people who have had knee or hip replacement surgeries. You can take it with or without food, but try to take it at the same time every day. You might need to take this medicine for many years or even for life. Don't stop taking Elixaban or change your dose without your doctor's advice. Stopping suddenly can increase your risk of a heart attack, stroke, or blood clot. To lower your risk of clots, you can make lifestyle changes like quitting smoking, eating healthy, exercising regularly, and losing weight if needed. The most common side effect is bleeding more easily, like getting nosebleeds or bruises. If this happens, tell your doctor right away. Other side effects include bruising, anemia, and nausea. Don't take Elixaban if you have severe kidney or liver problems, are currently bleeding, or are on other blood thinners. Avoid breastfeeding while taking this medicine. Unlike other blood thinners, you don't need regular blood tests, PT-INR, with Elixaban.